I tell my story to a lot of different groups. I'll tell my story, with the facts of FASD to really any group that'll hear it. Women aren't just out there, drinking it up, I don't care. They're suffering with alcoholism, or they have misinformation. They don't even know that wine and beer can cause the same problems as liquor. A lot of women still don't know that. I believe that secrets keep us sick. I have an adult 31-year-old daughter with permanent brain damage by no fault of her own. I buried 2 children that I honestly believe died as a direct consequence of being prenatally exposed to alcohol. I am taking some very tragic consequences that happened to me and my kids and using that story as a tool to maybe prevent other people from drinking during pregnancy. And in my mind, it makes our story go full circle.
Around the country, women like Kathy are speaking out about fetal alcohol spectrum disorders. They are sharing their stories to help other women stop drinking during pregnancy and to show that there is hope in recovery.
Drinking alcohol while I was pregnant, I wasn't able to stop because I didn't know how.
Everybody sees the signs on the bathroom doors and in restaurants and stuff.
I didn't feel I did it that much, like a handful of times during a 9-month period. I didn't think it would have any effect.
And they never could figure out why she was so small, why her head circumference was so small.
I really started noticing some behaviors that were very concerning from the time she was probably about 2.
I thought, something's wrong here. Either my husband and I are not very good parents, or there's something there that nobody else is seeing.
I think we have a problem here, and I don't want to go through this alone.
Well, maybe it's because I was drinking.
The day I found out Carly was permanently damaged because I drank, my world shattered. It was like a tidal wave came over me, even though I knew that was probably what it was.
Kathy noticed something was different about her daughter, even as an infant, but no one knew the cause.
I was worried about Carly when she was an infant because it was like she cried differently than my son had. She was delayed in that she wasn't pulling her head up like I thought she should. She didn't start to roll over or sit up or certainly walking, talking, crawling, all of that. All of those milestones were delayed. So I always had concerns about Carly, but I would go to the doctors and talk to them about it, and they would treat her ear infections and tell me that she was an allergic little girl and lots of babies had allergies and that she would grow out of them and I should not be concerned. And the only reason that she was delayed at all was due to these allergies.
As Carly started school, she continued to struggle, but her parents didn't know why.
She could learn things on Monday. So on Monday, she knew all of her primary colors and could maybe count to 10. And then Tuesday came along, and all of her primary colors were all confused in her head. The things she knew 100% on Monday, she didn't know on Tuesday. I would put expectations on her like, go upstairs, brush your teeth, change your clothes, get your book bag, and hurry it up. We have 5 minutes to get out of the house. And she'd go upstairs and would just shut down. She wasn't able to follow through. I gave her way too much information. We didn't understand that she had a brain disorder because she was prenatally exposed to alcohol.
When Carly was 9 years old, doctors told Kathy her daughter had cerebral palsy, a condition in which injury to the brain affects muscle control. But they were still unsure of the cause.
So we had no clue. She kind of blended in with her peer group up to that point. And you could tell that she was a child with some coordination delays, certainly some memory delays, but certainly never thought of her as a kid with mental retardation. And we always assumed she was going to kind of grow out of it.
Carly didn't grow out of it and was a teenager before her family finally understood the real cause of the challenges she had been facing her whole life. 2 years into recovery and studying to become a counselor, Kathy was at an addiction seminar when she realized that Carly's problems might be the result of her addictions.
I kind of went into a panic mode. What did I use? What did I use when I was pregnant? Trying to remember. And I recalled that I was using wine. And I used wine periodically. I was only 17 years old when I was pregnant with Carly. And I would drink on the weekends. But when I drank way too much because I have alcoholism. So I've always had this built-in tolerance where I could handle a lot of alcohol.
At the age of 16, Carly was diagnosed with fetal alcohol syndrome.
Once Carly was correctly identified as having fetal alcohol syndrome, it changed our whole world. What we did as a family, we met, and we had to say, you know, we have spent 16 years talking about what Carly cannot do, and we're not going to do that anymore. You know, and it was important for all of us to understand her disorder. So what we're going to do as a family is just feed her affirmations. We're going to think about what Carly's good at. And as a family, we were always collecting these things of what she was good at. And we are going to nurture those things and water those things and remind her of those things. Carly wants to help everybody. And she right now takes care of her grandmother. She's sweet and kind and loving. She's helpful. She's a great artist. And she likes to make people happy. Carly is our greatest gift.
Alcohol use during pregnancy hurts 1 in every 100 children born each year. But many women still don't know that there is no safe time and no safe amount of alcohol to drink when they are pregnant.
Essentially, alcohol is a toxin or a poison, so to speak. It has the ability to disrupt the actual growing brain, the development of the brain, the ability of the brain to wire up correctly for the different structures of the brain to develop to the right size in the proper places and to be able to function in the way it was supposed to function.
In addition to damaging the brain, alcohol can affect other developing organs, causing a wide variety of medical conditions. Collectively, these conditions are called Fetal Alcohol Spectrum Disorders. This umbrella term describes the range of effects that can occur in an individual whose mother drank alcohol during pregnancy. These effects may include physical, mental, behavioral, and learning disabilities, with possible lifelong implications. The term FASD is not intended for use as a clinical diagnosis.
Look at this one, it's Christmas, look.
One condition included within the term FASD is fetal alcohol syndrome, or FAS. Children with FAS are often born small. They may have smaller head sizes, or they may be small for their age. They have changes to their faces that may not be obvious, but can be detected by a specialist. Most importantly, like all children with FASD, children with FAS have changes to their brains that can affect their learning and behavior. Most children exposed to alcohol will not meet the criteria for FAS, but they still may have severe effects that change the way their brains work, leading to changes in learning and behavior. FASD is often invisible to the casual observer and affects each child differently.
People with fetal alcohol syndrome and fetal alcohol effects, or FASD, show a broad range of deficits. We don't expect to see everybody having the exact same problem every time. Depends on the timing of the alcohol exposure, depends on the dose of alcohol exposure, and a lot of other maternal and genetic factors too.
You might see, some difficulties with physical skills, balance and coordination. You might see very different kinds of difficulties with processing sensory information from, movement, touch, sounds, and what children see visually. So it really manifests itself differently.
To really understand what FASD is, it helps to meet people who are affected by it. Julie and her husband, Lynn, are foster or adoptive parents to 7 children with FASD. Meeting just a few of their children shows the wide range of effects prenatal alcohol exposure can have.
The youngest one, Cayenne, who is 5, cognitively is on target. Those aren't her areas of weakness. Hers are more in expressive language and especially in sensory integration. She doesn't, like the tags on the inside of her shirt kind of drive her crazy. She has a problem sometimes tuning out other auditory kinds of things that are going on in the background. Her first cousin, Brandon, on the other hand, who is 8.5, Brandon does have full-blown fetal alcohol syndrome, and he was diagnosed at 3.5 months. Brandon's areas of weakness is definitely in cognition. His IQ is 59. He has difficulty with fine motor skills, so it's hard for him in school to do handwriting and, printing, that kind of thing. Schoolwork is tough for him. Ricky has very obvious neurologic impairment. He has hand tremors. For the most part, he's very mellow, very friendly, but it doesn't take much. Just like out of the blue, all of a sudden, he could be having a rage. He doesn't really know where it came from, and it's done. It's over with as far as he's concerned. And then he has a hard time understanding why maybe the kid that he was having a fight with isn't over it, And then their older brother, Theodore, who is now 19, and we still have legal guardianship of Theodore as an incapacitated adult. Theodore has a verbal IQ of 55, which is moderately retarded for in the verbal IQ range. And yet you would never know it by looking at him. He is tall and he's handsome and he's a mother's dream of a son for the most part. He's compliant, he's respectful. And I can say, Theo, will you take the trash out? And he'll say, okay, Mom. Tessa's IQ is well within the normal range. She has some learning disabilities in math and in written language, but cognitively she's on target as far as her IQ goes. And I have had to fight for services all over the place for her because she doesn't qualify. So many things are hooked to whether or not you have a low enough IQ, and she just doesn't. And her especially, up until 4th grade, we heard constantly if she would just be quiet, she could read. If she would just sit still, she could do her math. If she would stop bugging the other kids. Everything was presented as if it was willful and manipulative on her part. And she got raked over the coals at home and at school because we just kept saying, Tessa, settle down. Concentrate here. I know you know these answers. And she really didn't.
After raising numerous adoptive children with FASD, Julie had a startling realization about her own birth daughter.
I've been in recovery for 24 years. I knew that I drank, with my oldest daughter. And yet, I told you, up until 1992, I didn't even know what fetal alcohol syndrome was. So even though I knew that Faith had problems in school that her other 2 sisters didn't, Faith is shorter and tinier than her other sisters, than the rest of the family. I didn't put 2 and 2 together until after I had been taking a bunch of the kids to the clinic. And I remember coming home, and I'd come home from those visits and I'd pull Faith's pictures out, of when she was a little girl and in her early teens. And I'd think, what, these kids, she looks just like my foster and my adopted children. She just has blonde hair and blue eyes. And I would remember what and how much I drank, when I was 17 and pregnant with her. And finally, when she was 25, I asked her if she would be interested in going to the clinic. And she agreed to go to that clinic. And when I left that day, I was the birth mom of a daughter with fetal alcohol syndrome.
Because FASD can affect children in so many different ways, it can be hard for mothers to tell if their children have been affected by prenatal alcohol exposure. Penny is in recovery for drug and alcohol addictions and drank while pregnant with both her son and oldest daughter.
My life before I went into recovery, it wasn't a life. It was just cocaine and alcohol. That's all I knew.
After Penny gave birth to her son, Liddell, she tried to get clean and sober, but she quickly relapsed.
I felt lonely, I felt alone, and I felt helpless, hopeless, a lot of days when I woke up.
It wasn't until Penny's second child, Deja, was born that she was able to make a change.
I wanted to be a mother, but I didn't know how. So I said, if I get clean, I can learn how. but I knew I couldn't learn being where I was.
Soon after Deja was born, Penny entered Avery House, a treatment center and halfway house for women with children. Liddell and Deja came to live with her as she started her recovery.
And that's where I learned to be a mom. We went through therapy, and it was wonderful. I mean, it taught me so much about being a mom.
Penny graduated from Avery House and built a life for herself and her children. Still in recovery, she is raising 3 children as a single mom, one day at a time.
It was a big change because there was a lot of things I had to do differently. I couldn't use anymore. I had to buy diapers. I had to change diapers. I had to teach positive language, instead of cursing and screaming and hollering. I had to talk very low, calm. I was never used to that. I'm still not.
As Penny has become the kind of mother she wants to be, she has noticed that both Liddell and Deja are struggling with issues that concern her. Liddell's behavioral difficulties first surfaced when he started school.
He was in Head Start. And, the teacher she was sending notes home. Liddell had an outburst. Liddell ran, he was running off. He's screaming to the top of his lungs.
Liddell was diagnosed with attention deficit hyperactivity disorder, or ADHD. Penny worked with his doctor to find medications and other strategies to help him in school and at home. As he grew older, he became very troubled emotionally. Deeply depressed following the deaths of several close family members, he was hospitalized. Penny has since enrolled him in a special school to meet his needs and help him manage his emotions.
When I get very mad, it feels like a volcano inside me.
If I don't help my son now, where is he going to be in 5, 10 years? And I knew he's going to be in jail or dead because of, his anger streak. He doesn't go from, being upset to being angry to, just dealing with it. He goes zoom.
Penny is concerned about Deja as well.
There's something going on with her too. I'm kind of, I'm watching her and she's very busy and she's very provoking. She's, and I ask her occasionally, are you upset about something? And she'll, no, I can tell.
In addition to problems at home, Deja struggles with certain subjects in school, particularly math. She has also developed a chronic urinary tract infection.
She's had it for 2 years. Unbelievable. I've never heard of a child having that for 2 years. And, I've been through so many tests and doctors, because I'm like, what do I need to do?
Recently, Penny learned about FASD at a conference for women in recovery. After hearing the stories of birth mothers and their children, Penny started to wonder if drinking during pregnancy had affected her children. She has shared this concern with her children's doctors.
When I go to those doctors, I need to be totally honest. Because if I don't, they're going to think, okay, well, is this hereditary? Does your mother, your father, And by not telling him it's me, it was me, her symptoms could be totally different, They could end up giving her the wrong medication for the wrong thing. So, I've learned to be honest with my children's doctors. And, by being honest, I get correct information.
Penny learned that the kinds of problems she sees in her children could be associated with FASD, not inherited, but caused solely by drinking during pregnancy. Penny wants to have them evaluated.
Whether it has anything to do with it, I don't know. But I just know that now that I understand, I want to be sure, because if it is, I need to know what to do. And I wouldn't want to have to live with the guilt that I knew something was wrong with my child and I didn't do anything about it.
We know that the 2 most important factors in the life of children that have been prenatally exposed to alcohol are, number 1, life in a stable and nurturing environment. And number 2, getting an early diagnosis.
If you as the parent really feel deep down inside that your child's just not getting it, that you just don't have the answers, that you're struggling, just to make the day, go relatively smoothly, that you're always seeming to have difficulties at school, I would really encourage parents to get a diagnosis if at all possible.
Identifying FASD early can help a child lead a happier and more productive life. But admitting that you drank during pregnancy can be a very difficult step.
You really need to suit what you do to where you are in your recovery. And the earliest stages of recovery are very challenging. They're hard. It takes courage to do it.
Some women seek services for their children without revealing what they know about the possible cause of their children's problems. They can take steps to get their children services while they continue to work on their own recovery.
I couldn't talk about alcohol, being alcoholic, drinking during pregnancy, but I learned to talk about education and therapies and what he needed and how he was different from my older son, how he was different from the other kids that I saw. And so I learned to navigate the special education and related services community before he was diagnosed or I had to tell any secrets. I still needed to tell those secrets at the end of the day at my support group or to somebody because they were still secrets and I was going to drink if I didn't stay honest with somebody about them because I still knew and I had to still hold my head up. To try and get him what he needed, but he got what he needed, and so did I.
It is easy to let blame and shame get in the way of helping your children, but taking responsibility is an important part of recovery and a source of hope for your family.
They never have any intention on hurting anyone. It's an addiction. It's a disease. It's the disease of alcoholism. So whether they want it to stop or not, they don't have any control to do that. So the accountability and the responsibility part of it all is standing up and saying, yes, I did this and I want to change this. I want to do something about this now. I want to help my children. I want to help myself. I want to better myself. And it's crucial to recovery. It could lead you back out there if you didn't start taking accountability and recognizing and being aware what your drug and your alcohol has done to your family and yourself.
Knowing that, I had caused my daughter to suffer with this for the rest of her life, it really, threw me into kind of a depression because it's like, I can't believe I did this to my child.
When I realized that I had worked my fifth step over and over and over again, and yet the one person that my drinking had harmed the most was my own daughter. And so that evening when I told Faith, that I wouldn't blame her, she was so angry with me that she never wanted to talk to me again. And, my daughter put her arms around me and said, Mom, why would I hate you? She said, why would I be angry with you? She said, you didn't drink because you wanted to hurt me. She said, you drank because you didn't know any better. And she said, and I'm just glad to know that I'm not stupid.
Do you mean you drank alcohol when you were pregnant with me? And it was one of those time stood still, eternal instant things. He's asking me a yes or no question. He doesn't want to hear disease, models, or progression, or what I knew or didn't know, or mental illness. He doesn't want to. He's asking me a yes or no question, and I say yes, I did. I hope someday you can forgive me for that. And we have this thing at our house, it's not okay to ask somebody to forgive you or to apologize just to get out of trouble. That's not okay to do. So if the kids think somebody's apologizing to get out of trouble, they should say, are you really sorry? So the person has to stop and think for a minute. So Michael, because I've trained him that it's okay to do this, says to me, well, are you really sorry? And I'm driving. There's nowhere to pull over. There's nowhere to run away. It's me and Mike in the car and the question. And I say, yes, I am really, I'm really sorry. I hope one day you can forgive me for that. While we're figuring all this out. And, I look over at him, and as only Michael can be, he says to me, I don't mind. I don't mind. Which is this 100% typical Michael answer. He's not saving this information to hold against me later. He has no resentments or grudges. He loves his mom. He has my undivided attention. Life is good to him. I don't mind. He says, I don't mind. I love you, Mommy. And so we go down and we do the rest of the day. And I'm next to him, and I have this voice. It was so clear, I almost looked over my shoulder if I hadn't been driving. That said to me, if he can forgive you this, who are you to not forgive yourself?
Thousands of children are born every year with birth defects due to alcohol exposure. Many of these brain changes affect learning and behavior, but are otherwise invisible. While the changes to the brain and other organs cannot be repaired, there is a lot parents in recovery can do to help their children. In Part 2 of Recovering Hope, more mothers step forward to speak out about FASD and share their stories of hope and recovery. Follow Penny as she takes her children to be evaluated. Meet a young woman who refused to let FASD keep her from pursuing her dreams. And visit with a new mother in recovery who is learning how to help her affected son.
I hope that other moms would be able to find that support that I've been lucky enough to find, not only in, with my husband, but with my family, with my daughter, with Faith, with other parents, with my kids. Those are all wonderful protective factors for me. They help me keep going day by day. And I think, that other moms and other parents can find that too. It's not easy. This is the hardest job that I've ever done in my life, but it's also the most rewarding and one that I wouldn't give up for anything.
Around the country, mothers of children with FASD are joining together to support each other. Together, they are finding ways to help their children deal with the effects of prenatal alcohol exposure.
I don't think there's hardly been a day that has gone by that this group of parents is not in contact with each other.
Women help women in recovery. That's always been my motto. The real main reason why that is, we're all parents. We all have a lot of likenesses.
Find at least one person that can help you figure out what it is you need to do, and then can help you do it.
Just being able to have the daily phone calls or emails to each other, and the camaraderie that we all have, and understanding each other, that we know what each other's going through.
All of a sudden, I didn't just belong somewhere as an alcoholic. I belong somewhere as the parent of a disabled child, which has the challenges in and of itself. Now I belong somewhere as the birth mom of a child with fetal alcohol syndrome. And it made a profound difference in my life.
We surround each other, we email each other, we meet once a month, sometimes twice a month.
And I can talk to these ladies, and they know exactly what I'm going through.
I have gotten so much help, it's just incredible. One of the biggest things that I'm an advocate for is that, when you go to treatment or whatever level you're at, there is so much help that you do not have to do it alone.
It's clear from 30 years of research that there's no known safe level of alcohol for every baby. A pregnant woman shares everything she eats and drinks with her baby. When a woman drinks alcohol, it passes into her bloodstream and spreads throughout her body. As soon as the alcohol is in a pregnant woman's system, It enters her placenta and passes to the baby through the umbilical cord. Alcohol goes directly into the baby's bloodstream, where it can damage the brain, the face, and organs that are developing at the time. Not all babies are affected by the same amount of alcohol. Some are much more vulnerable to the effects of alcohol than the others. And it's impossible for a woman to know how vulnerable her baby might be. Women drink during pregnancy for many different reasons. Christine's daughter, Clarissa, has fetal alcohol syndrome, but Christine is not an alcoholic. She became pregnant unexpectedly when her long-term birth control failed. Although not addicted to alcohol, Christine was a binge drinker, a drinking pattern that is particularly dangerous for the fetus.
So they immediately sent me for an ultrasound and found out that I was almost 5 months pregnant. And I didn't say anything at the time, but I had been, kind of just my regular 18, 19-year-old behavior, partying all the time. Her dad was in the military, so we were in Germany and drinking and, just having a grand time. And so it was kind of at that point that it was kind of scary to know how much I had drank and to find out that I was pregnant. And I didn't really realize the ramifications of it until I took her to the clinic and discovered that's what it was.
Mary is a recovering alcoholic and a doctor. She knew the dangers of drinking during pregnancy, but couldn't stop while pregnant with her son Michael.
Many scary and ugly things have happened to me in my life, but that pregnancy was the worst time of my whole life. It was agony to have drank that at 7 months and have all this information and know what could happen. Because I think women who drink while they're pregnant either don't know, or in my case, I knew that there could be a problem. I had no idea people could stop, that there was hope, that there was recovery, and I didn't know who to tell or ask for. I didn't know anything about asking for help. It was a skill I had never learned.
Mary's husband supported her as she struggled with recovery.
You think it's something you can control, when in fact you really look at alcoholism in a whole different way, because this is something that's totally out of control. And you can see it right in this circumstance, because you never want to do anything to harm your children. And in fact, this is something that's going on that you really don't have control over. When you don't, you feel helpless at times, but now that he's here and working with it, it's a whole different ballgame.
Many women just don't know that there is no safe time, no safe amount, and no safe type of alcohol to drink during pregnancy.
Because I was thinking to myself, well, I'm not an alcoholic. I don't drink all the time. I don't drink every day. I drink in small amounts, or when I drink every other weekend, or I only drink when I have a barbecue. So I really didn't think it was going to affect me.
Stopping drinking at any time during pregnancy is much more important than not stopping at all. So even though you find out you're pregnant and you've been drinking, it's better to stop now. Don't take that hopeless feeling of, oh, I've already been drinking. What more can go wrong? A lot more can go wrong if you continue drinking during the last 2 or 3 parts of your pregnancy. There's a lot more that can go on that hasn't gone on already. Stopping drinking can be very difficult, and women need to gather as much support from friends and family as they can get.
And if they don't have the support, if the significant other continues to drink, it makes the process of staying abstinent for the person who is in recovery or trying to get into recovery very difficult.
The dangers of drinking alcohol during pregnancy were not always known. Marcy was an executive with the Girl Scouts of America, and no one suspected she was an alcoholic. During Marcy's pregnancies with her 2 daughters, her doctors were concerned about her having a miscarriage and actually recommended that she have a drink to relax.
My doctor did, in fact, say, it'd be a good idea to have a cocktail in the evenings and, stay relaxed and all that kind of thing. Well, you tell that to an alcoholic, and for a cocktail for me, a couple of fairly large drinks.
Both of Marcy's daughters, Steph and Sydney, were born prematurely and undersized, but the effects of Marcy's drinking during pregnancy were not recognized until her younger daughter, Sydney, was in school.
Well, I started noticing, feeling like there was something different about me, all the way back into first grade, because when it came to certain subjects, I always felt like I wasn't able to grasp the concept like all the other kids were doing. And I mean, I would literally look around the room and, as we were listening to our teacher discuss a subject matter, I felt like I was screaming inside, like, I don't get it, I don't get it.
Sydney had been struggling sometimes in school, sometimes doing fine. There was no consistency to this. She had an average IQ, but her performance was way down here. She was called lazy. She was called this. She was called that. What is it, the not working up to your capability bit? And I talked with her 6th grade teacher, and he suggested that she be tested for learning disabilities.
These tests were expensive and money was tight. By this time, Marcy was in recovery and was taking classes to become an addictions counselor. She heard about a study at the University of Washington and thought that might be a way to have Sydney tested to better understand her disabilities.
When I spoke to the clinic manager, I said, it's important for you to know that she doesn't have FAS. She looks just fine, but I was drinking when I was pregnant, and she got a diagnosis of full fetal alcohol syndrome.
Marcy had trouble believing the diagnosis.
I had deep down in my bone marrow, I guess, that thought that how could a well-educated, well-brought-up, professional woman possibly have a child with fetal alcohol syndrome? Now, I had gone through that same issue with acknowledging my alcoholism. I went through it again with the fetal alcohol syndrome.
But for Sydney, the diagnosis was a relief because it helped explain many things in her life.
There's a reason why I'm struggling so much inside my mind and feeling like an outsider. There's a reason why. I'm not stupid.
When Sydney was diagnosed, they said, do not expect her to ever graduate high school. That was one of the things. She will never be able to work, enter the world of work. She will always live at home or in some sheltered place. And you need to be thinking about that and planning for that.
Marcy and Sydney decided not to give in to hopelessness and looked into supports for her at school.
But this marvelous school counselor really helped us out. And then he had her write a letter when she went from junior high to high school and would have to, go from class to class. The letter was copied and her high school counselor gave it to each of her teachers each term. And she explained in this letter what her learning style was and what she needed.
Sydney then followed up in person, talking with each of her teachers at the start of the school year.
I don't want you to think any differently of me, that I'm trying to get any special treatments, because I just want to be a part of the class, just like everybody else. I want to be treated the same, but there will be times where I may struggle more than the other kids will, and if I can talk to you privately at that point in time, is this okay?
With the cooperation of her teachers, Sydney made her way through school academically. But as Sydney grew into a teenager, many of the behavioral and judgment issues associated with FASD made life very difficult.
Because I was pretty insecure about myself in the dating scene, and so when I did find somebody who really cared for me and that I cared for that person, he turned out to be very controlling, pretty abusive emotionally.
And I could see all those, the poor judgment, the no impulse control. I could see it vividly in action. That I began to realize this is fetal alcohol syndrome, and I'm going to have to deal with it. And so we started on a roller coaster ride for about 3 to 4 years of just very difficult times.
Marcy also sought help for Sydney from a psychiatrist.
The psychiatrist said to me, as he was working with Sydney, she was 16, and he said, I'll help you learn what's FAS and what's teenager, and then how to parent that. And then he said, if she lives, she will take a growth spurt, a maturity spurt, when she's 27 or 28 years old. Most of these young people do. Well, 27 or 28 years old seemed like 1,000 years from now. And when he said, if she lives, I had to come to the grips with the fact that she is extra vulnerable. And sure, all teenagers are vulnerable, but lacking any decent judgment skills, no impulse control, she was a victim waiting to happen.
By seeking help, Marcy and Sydney worked their way through her teen years. Sydney is proving those early predictions for her life wrong. She graduated from high school and went on to work with animals as a veterinary assistant. With the support of her family, Sydney is now starting her own business. She is happily married and is looking forward to her future.
My dream is to be a mother with a healthy child, to be a good mom. That's my dream.
Having heard the stories of birth moms like Marcy, Penny has decided to find out more about her children by taking Liddell and Deja to be evaluated for FASD at the Kennedy Krieger Institute in Baltimore, Maryland. Dr. Paula Lockhart is a child and adolescent psychiatrist and the director of the Fetal Alcohol Research Center.
I'm their parent, but there's a lot that I don't understand about them. And hopefully today this can give me some kind of, direction and focus on, what I can do, to, help them.
First of all, I'm going to talk with your mom for quite a while, probably, it might be a couple of hours, okay, because she's going to give me a lot of information about herself and about you, the two of you. So I'll need to talk to her a while. I'll be talking to the two of you later individually by yourselves so that I can understand how you're doing and if there are any issues to sort out to make things better. You have any questions?
Dr. Lockhart talks with Penny to get a detailed history of the children and their family, and also talks about a wide range of issues that children may be facing. She then examines both Liddell and Deja and records physical measurements such as head size, height, and weight that play a role in making a diagnosis of fetal alcohol syndrome. She talks with Liddell and Deja individually and asks them a series of questions that help her better understand their psychological issues and to determine how much prenatal alcohol exposure has affected them. At the end of the day, Dr. Lockhart asks for copies of school testing results and talks with Penny about arranging for more tests. At this point, she cannot make a final determination about the extent to which Liddell or Deja are affected by prenatal alcohol exposure, but her preliminary findings are surprising to Penny. She starts with Liddell.
I don't see a whole lot of alcohol-related cognitive problems. His executive functioning, how much help he needs to be able to keep himself together, to organize himself, to show good judgment and those kinds of things. But he seems to be able to do a lot of those things very, very well. So, and he seems to be improving over time. And he's only 11. So I think that's why I tend to downplay, the effects. And he, I think he was really, he's done fairly well.
Dr. Lockhart finds it is Deja who is more affected by prenatal alcohol exposure.
It does appear that she has some dysmorphic features and she has some organizational problems. It sounds like she has some executive functioning problems. And so it may be that she might be actually a little bit more affected than Liddell.
Penny and Dr. Lockhart agree to arrange for more testing in order to make a final evaluation. But these results give Penny a clearer sense of what she needs to do next to help her children.
Once you open up, you never know what's in there. Basically, I could get everything I need here just by opening up and being honest and asking for the help. Now I can take the next step, find out what I need to do. It's not as hard as I thought it would be, so I'm ready for the next step.
For many parents of children with FASD, an important next step is understanding the connection between changes to the brain and their children's behavior. Paul Connor studies the structural changes of the brain caused by prenatal alcohol exposure.
Where before they were thinking of their child as being willful and belligerent, they can look at it now, okay, this child has brain damage. That means that this child can't inhibit his or her responses as well as say, their healthy brother. So that gives the parents the information that they need to change their perspective on their affected child and work with them in a different way.
Really realizing that she's not mentally the age that she is physically, knowing that you can't discipline her like any 8-year-old or 9-year-old. You can't just ground them and take away TV because mentally she's probably only about 3 or 4.
They're helpful. They're loving. They're very sweet kids, but it takes time with the structure. You just can't turn them loose like you can all the other kids. You have to be with them.
We do a lot of environmental modifications, so we're proactively modifying our environment all the time to try and prevent the behaviors from occurring so that we don't have to discipline, much. And when we do have to discipline, we really try and use natural and logical consequences. Something that's going to make that the consequence makes sense or it's connected to the behaviors. Otherwise, these kids don't get it.
Deanna is a mother in recovery and works as an advocate for mothers who are struggling with addictions. After learning about FASD through her work, she realized that her son Mark had been affected by her drinking during pregnancy. Deanna contacted a family counselor for help managing Mark's aggressive after-school behavior.
Imagine that your life and your home is like an airplane, and he's in the cockpit, and he's trying to be the navigator, but he doesn't want to be. He wants somebody else to be, and his acting out and everything is basically crying for that. He wants rules, he wants boundaries, he wants to know exactly what the limits are, and he's testing all of that with you. And if you're not going to give it to him, he's going to keep on. So I did. So I had to lay it out.
Deanna created a checklist for Mark that outlines what he has to do every day when he comes home from school.
When you come in the door, this is where your backpack goes, just step by step, and then he could go and look, cross it off, know what he needed to do, and things started to change. I never saw it like that. I never saw that he was needing just a well-defined space and set of rules for him to be at ease, for him to feel comfortable, for him to not be spinning out of control and afraid.
Children with FASD have changes to their brains that can affect physical development, learning, and behavior. While the changes to the brain are permanent, the extent to which they affect a child's life depends on the kinds of support that are provided. Birth to 3 early intervention programs are available in every state and are a good place to start getting a child help.
Basically, it's just making sure that the kids are getting the services and get them ready in all the areas, cognitive, development, physical development, to make sure that when they go to school, they have the best chance to succeed and enjoy school.
Some programs include playgroups for children with a wide range of issues, where parents can learn from experts and from each other.
Anton, would you like to sing a song?
Anton is a happy, active little boy, but when he was born, doctors thought he might never walk. His mother never gave up on him, though, and she never gave up on herself.
I spent probably around 8 years trying to get off substances, alcohol and drugs. Back and forth, treatment centers, doctors, psychiatrists, various things. And I didn't stay clean much more than 3 months at a time. Then I'd use for a year and then go back in. And then it kept getting worse and worse and worse, And this last time, I ended up pregnant and really sick.
Marit checked into a detox center and found out she was almost 7 months pregnant. Anton was born a month later.
I had no motherly instincts at all, and I didn't know how to hold him, and he was this tiny little thing, and he was constantly swaddled, because if you let him out of the swaddle, he was just shaking, just, not because he was scared, that's just what his body was doing because of the damage. Yeah, I was terrified.
Marit transferred to a halfway house for women to continue her treatment and recovery. She decided she wanted to be a mother to Anton, but was worried about her ability to parent him.
In the beginning, the outlook was very, was not good at all. And he was diagnosed with full fetal alcohol syndrome at an early age, at 8 months.
While in treatment, Marit became part of a parent-child assistance program. Her advocate, Brenda, helped her find the services and support she needed to create a life for herself and her son.
She just needed someone to back her and to give her a little hope. I guess to be hopeful when she couldn't be hopeful, and to be that courage when she couldn't have courage.
Marit felt an enormous amount of shame that her drinking had hurt Anton, but she decided to put this feeling aside and seek help for him.
When I started asking for help, it was like shame. I just felt horrible. People are gonna, crucify me and stone me to death. And everybody is so happy to meet him and to meet me, and this is so great that you're getting involved. And that just boosts up my self-esteem that, yes, I am doing things, I am doing something for my son. And each time, that I was praised for that, I was like, yes, I can do this.
Anton was underweight and had severe feeding difficulties. He was also overly sensitive to touch and to the sights and sounds around him. Brenda helped Marit find services to help Anton. A physical therapist recommended games that could help his motor skills. An occupational therapist showed Marit how to help him adjust to his environment. And a speech therapist taught Marit new ways to work on language with Anton. As Anton grew into a toddler, Marit and Brenda continued to find the early intervention services he needed.
So, he goes to class twice a week for 2.5 hours, where he goes with other kids, with various disabilities. He goes there, and then he has speech therapy there. Speech therapy is the big one, because he was speech delayed, or is speech delayed.
All of the therapies and special attention are paying off for Anton. He is already reaching milestones his doctors thought might always be out of reach.
And just in the last couple months, he's been really taking off.
Anton has also responded positively to the structure early intervention activities have provided.
When he knows what to expect, he's able to open up and to learn new things and be aware of his surroundings better. Early intervention services are about keeping those delays to a minimum.
With Brenda's help, Marit has found ways to help her son. They are beating the odds together. It doesn't matter how much money a woman has or the color of her skin. Drinking alcohol during pregnancy can permanently affect children, but support is available. If you know someone who has a substance abuse problem or who has been drinking during their pregnancy, support them in seeking help. There is no shame in wanting a better life for a child and recovering hope for the future.
The most important thing for a child is to have a parent who's sober.
Making it an awareness that you know that you drank during your pregnancy is the first step to changing your whole life.
There's nothing that you can do about the past, but today, you can make some changes and you can make the difference in this child's life, in your life. You can start making healthier choices. And that statement alone, if they're abstinent and in recovery, it's power.
Here we thought we had to pull together to teach Carly everything she needed to learn, when in essence she had been teaching us the whole time.
That's what we want, is what's best for our kids, whether they're 2 or 22 or 42. You know, that we want what is best for our kids.
You just don't give up on them. You know, the Creator don't make junk. You don't give up on them.
And you know, the big thing is I have a choice to be the kind of mother that I would want to be.
I can have my children look at me and be happy with me being their mother.
And it wasn't too late to get sober. And it wasn't too late to change my career. It wasn't too late to learn how to play in the mud. I'm a big proponent of it's never too late.
It's meant to me, I'd have to say it's meant a life.
If someone you know is seeking treatment for drug or alcohol abuse, use SAMHSA's Substance Abuse Treatment Facility Locator to find resources near you. For copies of this video, or for additional information and materials on drugs and alcohol, contact the National Clearinghouse for Alcohol and Drug Information. For additional information, resources, and training on FASD, contact SAMHSA's FASD Center for Excellence. If you are pregnant and concerned about how alcohol or drugs may be affecting your baby, contact Otis for help finding medical consultation near you. If you think you may have a child who was exposed to alcohol during pregnancy, contact the Circle of Hope, a birth mother's network at NOFAS, for support for you and your child.